It was a promise made on the last federal election campaign trail, making marijuana legal in Canada. Well, in exactly 1 week, it will be legal for you to possess and consume recreational marijuana in this country. But legalization is not without controversy. Is the country ready? Joining me now to talk about the impending legalization is the government's point man on the issue, former Toronto Police Chief, now Minister of Border Security and Organized Crime Reduction, Bill Blair. Minister, thank you very much for joining us this morning. A week to go. Are we ready?
I'll tell you, we've been working relentlessly for the last 2.5 years, and I know people talk about legalization, but the fact is we're regulating the daylights out of this thing. We're regulating every aspect of its production and distribution. The provinces and municipalities right across the country have been working hard in developing regulations to control its consumption. You know, it has been a drug that has been with us in society. It's the most commonly abused, currently illicit drug in the country. And we're getting it under control, I think. Right now we have the highest rates of cannabis use among our kids, and through regulation and public education we want to reduce the incidence of its use among our kids. It's 100% controlled by illicit organizations, organized crime and criminal enterprise, and we're trying to take that market and profit away from them. And so, you know, what I think people will see is a highly regulated environment and a situation where, you know, the drug was sold on street corners and plaza lots, and now it's going to be in a strictly controlled environment with health warnings and potency information so people can make informed choices. And it's a bit of a change for society.
Now, there are some concerns with it about impairment. People are saying we don't have anything that can actually test for it properly for people who get behind the wheel and drive impaired. How's the federal government dealing with it?
Actually, we listened very carefully to the police and looked at what is going on in other jurisdictions. Impaired by drug has been a crime in Canada since 1925, but the police have long been asking for more authority in order to detect the offense, access to new technologies that have been in use in other jurisdictions, Australia, New Zealand, and many European countries for almost a decade, to a very positive effect. You know, and they asked us, you know, to also make some investments in police training. And so we've done all three of those things. We brought in new legislation that created new offenses, gave new authorities and access to new technologies. We've then approved that technologies, and the first device has been approved. Others will subsequently be approved. And we invested close to $161 million to begin the important process of training police officers in the skills that they're going to need and that they said that they required in order to be effective. I think it's very important. This has been a problem with us for decades. You know, there was a recent study just released by CAA earlier this week that indicates among cannabis users, frankly, an absurd number of people have been consuming and driving, and that's dangerous. And now, perhaps for the first time, the police are going to be able to detect this offense, to prosecute it. And the prosecutions are complicated and not easy, but the police will now have the tools to detect and therefore deter. And I'm hoping that once people become aware of the danger and the likelihood of getting caught and the consequences of getting caught, then perhaps we'll see a significant reduction.
With police, different forces are bringing in varying bans on if officers can smoke it or not. Toronto Police, it's 28 days before working that they can't smoke marijuana or smoke cannabis or use cannabis. Is that something that there should be an across the country set up for, as opposed to individual forces?
Chiefs quite responsibly are looking at how that they can make sure that their people are fit for duty. The police officers do a very important job in society, as do others in the fire services and other emergency services, in the military, and there are other, you know, safety-sensitive jobs right across the country. And so we need to make sure that there's good science behind the decisions made to make sure that everybody in the workplace is safe. And so I know the police chiefs are taking a very cautious approach, but I think we've still got a lot of work to do to make sure that the science is appropriate and that, you know, that people who work in those professions are safe in the job place, but also are afforded the rights of every other citizen.
So you see that number changing, that 28-day?
Well, what I see is, you know, I think, again, the police chiefs are beginning quite cautiously, and I understand their caution. I used to do that job. And, you know, police officers do important work, and their job is to keep people safe. And so we want to make sure that they're fit for duty. But again, as long as there have been police services, we've had a standard of fitness for duty. It was, frankly, easier to determine with alcohol. But, you know, cannabis is not new to our society, but, you know, now under a legalized and regulated regime, you know, there is a concern that if police officers are going to ingest this drug recreationally off duty, they have to be fit for duty when they report.
Okay, and with the border, are you talking with American counterparts about this? The president was saying that these people would not be allowed into the country.
Yeah, you know, we've had quite a number of conversations with the Americans, and their every indication is that it'll be business as usual. But it's important to understand what business as usual is. The border security agents at the U.S. border and the Canadian border have the authority to exclude people from coming into their country or us to ours on any basis. And so, frankly, if you show at the border and either you're smelling of marijuana or you indicate to the border agent it's your intention to go down and engage in a business that in their country is unlawful, then they're going to exclude you. And so the Americans have indicated business as usual, and we've had a marijuana industry in this country for over a decade for medical marijuana. We have over 4.5 million Canadians who admit to using this drug, and they have not been excluded in large numbers from entering the United States. So I think business as usual will be just that.
Okay. Minister, thank you very much for joining us today. And again, legalization takes effect in 1 week, October 17th. City TV continues to have extensive coverage on the issue leading up to and beyond legalization day. Let's head upstairs now to Mel. Mel.